We find that एक मेंबर तो घर का कुछ ना कुछ ऐसा सफर कर ही रहा होता है, तो आप क्या सोचते हैं ये पेन सबको आजकल क्यों इतना ज्यादा लंबा पेन रहता है? जब से ये वर्क फ्रॉम होम का कल्चर आया है तो पीपल फील कंफर्टेबल सिटिंग ऑन देयर बेड एंड वर्किंग।
ऐसी लोग यंगस्टर्स को बोलते हैं सिर्फ पैसा क्यों लगा रहे हैं? No, you have to know the whole body and all the components of fitness.
So any basic tips that you want to give to our viewers जिससे उनका थोड़ा सा कुछ इम्प्रूवमेंट हो सकता है?
See, after every training session, there is some damage to the muscle fibers, fibrils are broken down, actin filaments.
What if I tell you that after listening to this podcast, your chances of getting injured will drastically reduce to negligible? Because आज का podcast बहुत ही स्पेशल होने वाला है। आज के पॉडकास्ट में हम बात करेंगे कि सारे रिनाउंड क्रिकेटर्स, गोल्फर्स, एथलीट्स और बहुत से ऐसे रिनाउंड स्पोर्ट्स पर्सन्स आखिर ऐसी कौन सी स्ट्रैटेजी, कौन सी टेक्निक्स यूज़ करते हैं जिनसे उनकी लॉन्जेटिविटी बरकरार रहती है, उनको इंजरी प्रिवेंशन में हेल्प मिलती है और उनकी परफॉर्मेंस डबल या 4 टाइम्स एक एवरेज ह्यूमन से इन्हांस हो जाती है। आज के पॉडकास्ट के हमारे स्पेशल गेस्ट ना सिर्फ हमारी इंडियन क्रिकेट टीम को बल्कि वुमेन इंडियन हॉकी टीम को ओलंपिक्स लेवल तक पहुंचा चुके हैं और यही नहीं, बहुत सारी स्पोर्ट्स एसोसिएशंस जैसे कि बीसीसीआई, पीसीए, इंडियन नेशनल हॉकी टीम वुमेन के साथ भी एसोसिएट हो चुके हैं। So let's welcome Dr. Satbir on our show, Sipwithstars. Hi sir, very warm welcome in our show Sipwithstars and we are super excited to have you with us today. Thank you for giving your time.
Thank you so much, ma'am, for inviting me on the show. I've heard a lot about this show.
Yeah.
And recently I even saw, I think Anju Modgill was there.
Yeah.
International shooter. So I saw that one. So I was very excited and thankful for inviting me.
And we were excited to have you with us. Okay. So sir, first question as for the viewers, I want to know that आपने sports medicine ही choose क्यों किया? Because this is, something which is very unique subject, जिसको generally हमने देखा है लोग नहीं prefer करते हैं.
Yeah, at that time when I started in 2005-07, that time it was not, sports medicine was not in this thing, prime specialty. But I used to do myself, sports. I used to do basketball, swimming, athletics in college, university. So I always had that inkling, and I was clear, that I would be doing sports medicine.
That's right.
And a lot of people advised me against it, saying that India में इसका scope नहीं है, and that you will भूखे मर जाओगे, and you will not be able to earn enough, and all that. A lot of demotivation, even from the family. But I was determined, and touch wood, with the grace of God, now we are treating people from the entire region, entire North India. Last week I had a guy who came to me from Mumbai. He's a player in Premier Hockey League, Premier Kabaddi League. Wow. He flew down from Mumbai, came, got himself treated and went. But touch wood, we are doing fine, and with the grace of God, and you are seeing it.
And yes, of course. And I have also heard that you were a part of army also at one given time. What provoked you to, leave the army and come into this field?
That time, my passion was to do sports medicine only, as I told you.
Yeah.
But sports medicine as a specialty was not available in the army at that time.
Achha.
I was getting my MD medicine from R&R, Research and Referral Delhi. But I was like, no, I have to do sports medicine only. So that was another reason that brought me down. And immediately I got my seat in 2005-07 at NSNIS PATIALA, and I was the merit number 1 when I joined NSNIS PATIALA.
Wow, that's wonderful. Okay, sir, I have seen very often कि जो सबसे common question मैं पूछना चाहती हूँ कि lumbar pain या low back pain जिसे हम कहते हैं, usually we find that एक member तो घर का कुछ ना कुछ ऐसा सफर कर ही रहा होता है, तो आप क्या सोचते हैं ये pain सबको आजकल क्यों इतना ज़्यादा lumbar pain रहता है?
There are 3-4 factors in it. One of the most common is lack of exercise and poor extensor muscles. हमारी muscles बहुत, because as Indians we hardly exercise, especially ladies and the housewives. Second is poor posture. Now, right now I'm sitting in a correct posture. People tend to slouch and they tend to bend forward for long sitting hours. So these are the reasons. And second is the deficiency of vitamin D. So all these factors together they put across. And sometimes there are injuries, when you pick up while going to the gym or you're lifting a heavy weight from the ground. So these are some factors, which make it common.
Sir, also I have seen that जब से ये work from home का culture आया, though people feel comfortable sitting on their bed and working. Usually क्या होता था कि पहले ऑफिस में एक चेयर है, टेबल है, आपको पता है आप इस posture में बैठे हैं. लेकिन आजकल work from home में लोग कहीं पे भी बैठते हैं, अपने dining area में भी बैठ रहे हैं, अपने bedroom में भी बैठ रहे हैं. तो वो भी क्या एक reason हो सकता है?
Yes, I recently had a patient who typically came with this person that I have work from home, and this is my position, this is my posture. Whole day he is like this, and this is the position, and he's on the bed and he's working. So I said, this is a basic problem.
Yeah.
So first we corrected that, then initially controlled the pain and inflammation, muscle spasm, and then put him on a rehab. And he's fine now, and he has been strictly advised to follow the posture right. And I said, otherwise nobody can help you. See, if you are not ready to help yourself, then nobody can help you. So I told him, and he's doing fine now.
तो जैसे सर हाउसवाइफ्स जो होती हैं, लेडीज जो हैं घर की, वो कहती हैं हमारे पास तो टाइम ही नहीं है, हम कहाँ से एक्सरसाइज करेंगे. सो एनी बेसिक टिप्स दैट यू वांट टू गिव टू आवर व्यूअर्स जिससे उनका थोड़ा सा कुछ इंप्रूवमेंट हो सकता है?
See, most of these exercises, some yoga, aerobics, or back strengthening exercises, they are very simple exercises. For this, you do not have to go to any gym. They can be done at home also. The simple back extensor exercises, you can do it at home, like yoga or cobra poses. You can do it at home. There is no problem. Or you can do bridging. Or you can do that Superman. You can do it on bed, on couch, or on the floor, just with a mat. So most of these things they can be done at home. It's just that you need to have a will.
Yeah, one should be willing to do so. So what are some common misconceptions about sports injuries that you encounter?
Most of the time, the people mistake their injuries, as soreness, and they're not willing to take immediate help. They keep ignoring it. ठीक हो जाएगा that way. So I think the immediate treatment is most important, so that we can have early cure, and it doesn't linger on and doesn't see. In case of athletes and sportsmen, the entire season is important.
Yeah.
If you delay it, you end up losing a complete season or a lot of important competitions or championships. So the moment you have a niggle, consult a sports physiotherapist or a sports medicine doctor.
Yeah.
So that's my
So that
advice.
you can cure at the right time.
Right.
Yeah. What are your top 5 tips for preventing injuries during physical activity?
Okay. 1, start slow and slowly build up your time and intensity. That means what happens these days is people go to the gym and on the very first day they want to hit hard, they want 60 minutes of this thing. Trainer also wants to show all his skills on day 1 to the client, and after that the client is in bed for 3 days and he would never come back again, and it's a dropout. So maximum dropouts happen because of this. So you have to start gradually and slowly and then build it up. Second thing, work on all the components. You work on your cardio, aerobic capacity, you work on your strength, you work on your flexibility and other motor skills, so that it gives you a balanced fitness this thing. And सिर्फ डोले बनाने से नहीं है. I see a lot of youngsters go to the gym सिर्फ bicep बना रहे हैं. No, you have to work on the whole body and all the components of fitness, not just one, so that gives you holistic health.
सिर्फ look चाहिए आजकल.
Well, that's the problem.
That's the problem. They don't want to, build their body in a proper shape.
And look also, if you have a balanced body, if you have symmetry,
Yeah.
that looks better. Now, if you go for any bodybuilding competition, their symmetry has its own points. So if you have unusually strong biceps and the rest of the body is weak, you look like a joker actually.
Yeah.
So I think the youngsters must realize this.
With very lean legs.
That looks normal.
And that happens due to lack of nutrition also, I believe. जितना आप exercise कर रहे हो, nutrition उतना मिल नहीं रहा.
They don't train their lower body actually much. They focus more on the upper body.
Yeah.
So whatever part you train hard, that will grow faster and better.
Right, sir. So can you discuss the importance of rest and recovery in a training program?
See, after every training session, there is some damage to the muscle fibers, fibrils are broken down, actin and filaments. And then these filaments again gather together stronger and a better hypertrophy, which we call it, hyperplasia and hypertrophy, both keep taking place.
Okay.
So, if you do not have proper rest and recovery, the muscle growth will be less, the strength, power which you gain will be less, and you will be more prone to injuries.
Okay.
So it's very important to have adequate rest between the sessions. Like if you train a major muscle group today, so then you should have at least 48 to 72 hours. You should not train that particular muscle group.
Sir, how important is warm up and cool down in an exercise session?
That's a very, very important question. See, you have to prepare a body for exercise.
Ji.
The muscle flow and regulation to various body parts, their flexibility, mobility, stretching. All these should, body should get ready for exercise. You have to prepare it for exercise.
Yes.
Otherwise, you will have those injuries. Overstretching, muscular injuries, tendon, ligament injuries. So if you don't prepare yourself for exercise, you're bound to have injuries. And at the end of the session, if you don't have a proper rest, recovery, icing, or if you ice baths, if you don't have those things, you need the lactic acid to build up after the exercise to get washed away, so that you have better recovery. And if you do proper stretching, so you will not have the tightness and soreness next day, and you will be able to train better and prevent injuries.
So stretching is to be done after the exercise or before the exercise?
No. Before the exercise, there are two different protocols. Before the exercise, we do dynamic repetitions and dynamic exercises. Okay. And after the session, when you have finished the training protocol, we do static stretching, where we hold the stretches for a long time, and then we do mild foam rolling, and the purpose is to wash off the lactic acid. So we do mild foam rolling also along with the static stretching. So there's a difference between the initial and the ending.
So what we understand is cool down is equally important. Because I've seen people working out and running back to home getting late.
No time.
Yeah, so I think that's the main component that they miss out, and then they complain of the injury.
Yeah, then they end up being stiff next day and tightness in the hamstrings, quads, lower back, and that leads to injuries.
That's because of this.
One of the causes.
Okay. And sir, I have heard that these days a lot of people are doing dope or using performance enhancing drugs, thinking that PCT will wash away all the side effects of that drug. So पहले तो मैं ये चाहती हूँ आप अपने हमारे viewers को बताइए कि ये dope test क्या है और इसके बारे में क्या misconception है.
See, all these performance enhancing drugs, the general public and the recreational users, they are all using it. There's nobody to check them, nobody to ban them. But all competitive sportsmen, those who are competing at state level or let's say university or national international levels, they cannot take it, it's banned, and they are regularly tested for it.
Yeah.
Now, let's leave them apart, the competitive sportsmen, because they are not supposed to take it.
Yeah.
Majority of its use is in the recreational people. The regular routine gym goers and all those people. Maximum usage is here.
Okay.
And there's no check on that. Now, it is not definitely good for health, but if you go with proper protocol, if you use ancillary drugs along with this, and if you do a proper PCT, then you can have some harm reduction. But that doesn't make you 100% safe, but you will have reduction in the harm which is being done to your body. So it's like, जो damage हो रहा है उसको control कर रहे हो, contain करने की आप कोशिश कर रहे हो. I'm going to BHU on 15th of November. I'm taking a complete workshop on anabolic steroids and higher this thing for the entire, it's an international conference. Dr. Peter Bruckner is coming from, Austria. He's known as father of international sports medicine. So they are conducting a half-day workshop only on this to advise doctors, physiotherapists, sports people that what it is, those who are taking it, what they're supposed to do, those that are not taking it, what they're supposed to do. International sportsmen definitely it's banned, they should not try it.
Yeah.
So I'm going to cover entire aspect of it.
So sir, international sportsmen, so there is a proper test conducted before they enter into the Olympics or anything.
Yeah, regular testing.
So regular test is conducted. So that's not advisable for them at least.
Definitely.
Yeah.
Because once you are caught, you lose 2 years or 4 years, and in those 4 years, another generation comes and then you're out. So you completely, lose track of it.
Lose their career also.
Yeah, you should not do it.
So what is stem cell therapy and is it different from the plasma replacement therapy?
Yeah, actually we are doing different types of therapies for musculoskeletal regenerative conditions. Cartilage, tendon, ligaments, where they have partial grade 1, grade 2 or osteoarthritis. बहुत ज़्यादा है पंजाब में, old age में होता ही है, knees, shoulders. So PRP is a different therapy and stem cell is a different therapy. Like in PRP we are taking out the blood, centrifuging it. So we are separating the platelet-rich plasma and the growth factors. Okay. It doesn't have stem cells. Okay. But it has regenerative growth potential. We are injecting it into various parts. Okay. And it helps us in regenerating, the tissues which have got damaged or trauma jahan pe hai. Okay. And we are getting very good results. We are doing it for most of the sports guys who come up with injuries who are into the season. And the best part of it is autologous. आपकी body से निकाला.
अच्छा, हमारी
body से निकाला, हमने इसको concentrate किया, centrifuge किया. Growth factors एक जगह पे concentrate किए और जहाँ पे जरूरत थी हमने वहाँ पे डाल दिया. So it helps in regeneration.
How long does it take, sir? What is the duration?
The duration is we do two generally sessions about 6 weeks apart. Like if we do one today, second session we do up to 6 weeks apart. So 2 sittings generally give you good result.
And is it affordable for everyone or is it very expensive?
Not very expensive. The kit costs about 18,000, and then the procedure charges which vary from 3 to 4,000.
तो सर इससे क्या क्या क्योर हो जाता है आपके अकॉर्डिंगली?
Grade 1, Grade 2, Grade 3 injuries of cartilage, tendon, ligaments, even muscles it is used, joints it is used. But if the damage is beyond 4, or if there is a complete tear, let's say you have ACL which has got a complete Grade 3 tear, that's not going to heal with PRP.
Okay.
So we advise them, you need surgery, so we do arthroscopic surgery and we repair that.
अच्छा.
So you should know, Grade 1, 2 in the beginning, minor sprains and strains, early degeneration, all these conditions will respond to that. And then coming to stem cells. Now recently the stem cells have been launched. Now I'll tell you what is stem cell. A stem cell is a one which, when put into any space or any joint in the body or any place, depending upon the local environment, it gets converted into that particular cell, whether it's cartilage, it's bone, or tendon.
Yeah.
So recently an injection has been launched which has got 3 types of stem cells combined into one, recommended for use by DGCI and launched by one of the big companies in India. It has got 3 million cells and recommended for Grade 2, Grade 3 osteoarthritis, and we inject into the joint. Has got very, very rich and high regenerative potentials.
Okay.
The entire growth of the human body actually takes place with stem cells. Initially, all the cells are stem cells only, and they divide to grow into multiple different body parts.
Right, right.
So that has come into it, and we have started using it.
Wow, I think that's excellent. Okay. सर एक क्वेश्चन मेरा ये है कि आप इतनी सारी टीम्स को इंटरनेशनल लेवल्स तक लेके जा चुके हो और देखा जाए तो क्रिकेट तो नंबर 1 पे चल ही रहा है ओलंपिक्स में आने के बाद, लेकिन आज भी हमारी टीम्स कहीं ना कहीं लैग बिहाइंड कर रही हैं स्पोर्ट्स के अंदर, तो उसके लिए आप क्या कहना चाहते हो? व्हाट्स योर से ऑन दैट?
Ma'am, I have my largest and the longest tenure and exposure is with cricket only.
Yeah.
I joined BCCI in 2010.
जी.
I was holding their Rehab Academy of the North, complete 9 states. It was with me in PCA Mohali, Punjab Cricket Association Mohali mein chalti thi. Then their state teams, women team, I was looking after training and rehabilitation of all state teams. So I got the longest exposure till 2022, almost 12 years.
जी.
I was also traveling as a team physician with the Punjab senior cricket team. I worked with most of them. So cricket is a very structured program in the country, right from the grassroots level.
Yeah.
So they have really taken care of the game very well. They have spent it in the right direction. Even the junior players, under 16, under 14, under 19, they have all good facilities, including kits, their travel, and everything is managed very well. Yeah. So I think BCCI and the cricket, they have marketed the game very well, and they have used it up to the grassroots levels to develop the game.
Yeah.
See, year after year,
we are progressing.
The international play which are coming, they're coming from the same cycle, 16, 19. Seniors, 16, 19 seniors. You see right from Virat Kohli.
Yeah.
He played 16, 19 World Cup seniors. Rishabh Pant was with me for 3 years, 16 to 19. North zone, zonal competitions, 3 years, 16, 19 seniors. So they have a very good chain, continuous system. In other games, that is not there.
Yeah.
They have a very structured program, and they are developing, stadiums and training facilities. And if you do not do it, then how are you going to reap the effects? How are you going to get the future athletes?
Agreed.
In other games, that is lacking. And secondly, one of the most important thing is, see, any sports or anything needs funds. You need a lot of money to develop the infrastructure. Let's say swimming pool. If you want all-weather swimming pool in the North India, which is very important, because in North India people train half of the time, 6 months they train, 6 months they are off. Then how do you expect people to excel in swimming?
Yeah.
So, and it needs a lot of funding.
Yeah.
And in most of the sports organizations, recently you must have heard that IOA and IOC, a lot of talks are going on. PT Usha ji hain, unki bhi baat, कई चीजें allegations, counter allegations लग रहे हैं. So कहीं ना कहीं they are trying to clean up the system because definitely there is corruption to some extent. The funds are not being utilized in the right direction, which is very important. And that's why I think PT Usha ji was saying that we need reforms and we need to change people, we need to bring in new people. So that we can streamline the flow of funds and they should be used in the correct direction. Only then we can grow.
क्योंकि ऐसा नहीं है सर कि इंडिया में टैलेंट नहीं है, टैलेंट तो बहुत है.
टैलेंट बहुत है, इतनी पॉपुलेशन है, पीपल आर एंथुसियास्टिक, पेरेंट्स आर एंथुसियास्टिक. आजकल अपने पेरेंट्स अपने वार्ड्स को बोलते हैं कि आप करिए स्पोर्ट्स, दे एनकरेज देम. माय डॉटर इज डूइंग स्विमिंग.
Yeah.
She is already, state champion under 9, under 11. She's 9.5. I take her regularly and she trains fine. So parents are doing it. Haryana में इतना sports है. हर family में हर बच्चा sports कर रहा है. Talent है, कोई problem नहीं है. But we need infrastructure and correct flow of funds and facilities.
Yes, that's most important.
Yeah.
Okay. Sir, एक athlete की psychology, उसकी physiology को कैसे change कर सकती है? मतलब अगर हम बात करें mental aspects की, तो आपको लगता है कि motivation से athlete की mentality change की जा सकती है?
It's not motivation exactly. It's the counseling, You need mental training actually. There's one thing called as mental imagery in sports psychology.
Yeah.
So you have to practice it again and again. And then there is competition anxiety. You should have an optimal competition anxiety. Too high is bad because that will lead to increase in heart rate, BP, and your stroke output will increase, and suddenly you will feel tired more, if the heart rate goes. So all these things, like let's say in case of shooters, they need to have very good cardiovascular conditioning. Slight increase in anxiety or pulse rate, everything you'll start shaking up.
I remember when I was interviewing Anjum, she told us that the heart rate plays the most important role.
So your sympathetic and parasympathetic control is very, very important, and that will come from mental conditioning. The yoga, meditation techniques, all those things help, and along with mental imagery. And a sports psychologist should be involved at the international level, so that he can guide into these things. Yeah. And I remember, Capt was there when India won the 2011 World Cup cricket. He was with the team, and everyone says that yes, it was very important, and he played a very important role.
And sir, I have noticed that more like games like athletics, अगर हम बात करें 100 meter 200, उनका mindset सोचिए अगर आप उस पे हैं. You're in some other mindset, आप कुछ और ही सोच रहे हो.
Absolutely, there even a slightest of a second delay or it can either lead to a false start or you lag behind.
Yes, exactly.
So it has to be very optimal.
Similarly for the shooters and other such games,
and
it's
others
very important.
Where we need a quick start.
I think sports psychologist plays a major role here.
Very important role. So you have to train your mind also along with the body.
Sir, I've seen a lot of interviews of yours जिसमें आपने बोला है कि कई बार ऐसा होता है कि लोग सर्जरी के लिए जाते हैं लेकिन सर्जरी की जरूरत ही नहीं होती. Is it true to say?
Yes, lot of times they're misguided.
Yeah.
And here the role of the doctor actually you have gone to plays a very important role. Now half the time people do not know that for these things whether they have to go to a sports physiotherapist or a sports medicine doctor or an orthopedic surgeon. Now I'm not pointing fingers at anybody, but sometimes the doctor whom you have gone to is too interested and too enthusiastic in doing the surgery than trying a conservative method.
Is it money making? Targets?
Yes, that is there. I don't want to say it openly, but those things play a role definitely.
But it's true.
So wrong guidance, yes.
We've been facing so many problems, and even in our relatives and our knowns, we come to know that surgery की ज़रूरत ही नहीं थी, लेकिन surgery कर दी.
If you read the literature, if you see research papers, they'll say 60% of the surgeries are bogus surgeries.
My God.
Overall.
तो फिर सब क्या हो रहा है ना, मतलब हमारे अगर हम बोले डॉक्टर्स के नाम पे अच्छे डॉक्टर्स भी हैं, बुरे भी हैं, लेकिन कुछ बुरों की वजह से सारा जो माहौल है वो खराब हो जाता है.
Yeah, and it's very difficult to predict. And this corporatization of the medical system has, doomed it all.
Yeah, I've seen few doctors, I know them personally also, who say that we left this hospital just because we were pressurized.
Exactly.
Yeah, they were supposed to meet their targets, which they didn't wanted to do because there was no requirement of the surgery or the treatment.
Few days back in one of the hospitals, there was an endocrinologist. He discharged a patient. Okay, and the management got after him. How dare you discharge him? We wanted to keep him for another 4 days. Now it should be the decision of the treating doctor or the management who is sitting to discharge the patient because they want to make more money by keeping him for another 4 days. So these things have definitely come up, and that's why doctors are not satisfied. A lot of them are leaving corporates and starting their own practice.
That's very sad. Okay, sir, any incident that comes to your mind जहाँ पे आपने किसी athlete को train किया हो, उसका season या उसका championship बिल्कुल सर पे हो, and you have a pressure from the coach that I want my athlete to be, treated in a given time span. कभी ऐसा pressure?
Most of the time we have this. 9 out of 10 times we have this pressure. Because they all come to us in such conditions. 2 days back, I'm telling you, there's a girl who came to me from Ludhiana, Radhika Singh. She has all India inter-university weightlifting competition. She came with a coach 2 days back. 5th November she has a competition, I think. He said, sir, she got 2 disc bulges and we are under pressure to treat her and deliver. Most of the time we have this condition. I treated a girl, tennis, she was going for nationals. She said, this is my last chance for nationals. Haryana government has added the job quota in this. Now if I get a national medal this time, my job is also through and my target is also through of getting a national medal. And I have got chances. And she was having meniscal injury. We did a PRP for her. She went, she got a bronze medal. उसके दोनों targets भी पूरे हो गए. So ये तो every day है हमारे लिए. Because for athlete, time is very important.
So now you know how to manage these things well.
This is the most important thing.
अब आपको target पे काम करना ज़्यादा अच्छा लग रहा होगा.
Because for sportsmen, this is the most important thing.
Yeah.
They don't have time. They want fastest recovery. They cannot miss competitions. मैं यादवेंद्र सर के साथ मेरी कई बार बात होती है. So he being an athlete himself, international athlete, he knows that what is the importance of the competitions, and you cannot miss. See, important competitions you cannot miss.
You cannot miss. You have to get here.
You have to. If possible. Yeah. Sometimes it's not possible, but most of the time you must try and get them.
Sir, लेकिन उस time पे मैंने सुना है कि बहुत सारे एथलीट जो है वो misguide भी हो जाते हैं because of some coaches who are not well trained, लेकिन उनको बोला जाता है आप ये टैबलेट ले लो, ये heavy dose ले लो, या कोई ड्रग ले लो, उसकी वजह से बच्चे का करियर भी खराब हो सकता है. This also again that anti-doping जो भी मैंने आपसे बात करी थी पहले भी ये हो चुका है एक बार.
Yes, it happens, and such people also come to us who have got their conditions spoiled.
जी.
Few days back, there is a model who came to me from Jalandhar. She had minor knee injury strain, I think some cartilage issue or meniscus issue. About 1 month back. She was given whole lot of steroids, anabolic steroids. This will heal your injury and this will do this. And when she came to me, she had all clear features of anabolic steroids. Pimples, acne, hoarse voice, and she was a model. And when I saw her, I was surprised. We treated her knee. Knee के लिए हमने PRP किया, I think it was a grade 2 meniscal injury. She responded well, rehab किया 1 week, she is fine. And after 1 week when she was coming, my attendants, my helpers, those my physiotherapists जो मेरे साथ काम करते हैं, they were not able to recognize her. So she is looking so pretty now. When she came on day 1, she was looking horrible. So ऐसे cases हमारे पास आते हैं where they got being treated wrongly, and they have got side effects or things have gone wrong, and then they come to us and we correct them.
अच्छा, इससे मुझे एक और बात याद आती है. आजकल लेडीज को बहुत हैबिट है, दे वेयर लॉन्ग हील्स और हील्स की वजह से जो साइड इफेक्ट्स आते हैं बाद में बॉडी के अंदर, उसके बारे में आप कुछ कहना चाहते हैं?
So definitely, when you're using high heels for a short duration, it's okay. Okay, I mean you can't stop ladies from wearing high heels.
Exactly.
But for a short duration, it's okay. But you should not wear them for long duration because that puts your ankle in such a position that you start getting metatarsalgia and the ankle problems. So advisable is go for a flat one, not too high. I would advise more than 2 inches.
Comfortable also.
And stilettos are the worst ones, and they can even lead to inversion sprains and fractures and multiple ligament tears. Those cases also come.
Because in the modeling, as you said, they are supposed to wear heels only all the time.
Supposed to wear.
Sir, any advice for those parents who want to put their children into sports?
Yes. It's very important, now with the awareness and with the recent success of various sports, a lot of parents are interested and they want to put their children to various sports. So one is that you should start early. बच्चे को जितना जल्दी आप लेके जाओगे फील्ड में उतना बेटर है, whatever be the sport.
Okay.
Second is talent identification. You should know what is the capability of the child, what is the interest of the child. बच्चे का interest किस side है. So all these things are important. If somebody is interested in boxing and you want to put him into swimming pool, he's not going to excel. So interest of the child, talent identification, and start as early as possible. And then initially, couple of years, let's say 4 to 8 years, work on all the motor skills, strengths, general whole body development, all motor components of whole body. Don't go specific. And later on, after the age of 8 years, you start specializing with the specific inputs of that specific sport.
Okay.
I have seen parents, who are there into golf and some games, where they did specialization right from the age of 3 years. Now the child's whole body was not conditioned. Now start getting multiple overuse injuries and pains and aches in different areas, and motor skills were not there. Plantar fasciitis and other things. So initially, general whole development of the body, develop all motor skills, general strength, general fitness components develop करने हैं. And once you reach that, then after the age of 8 years, you should do specialization training of that specific sport.
सर आपने जैसे बोला है कि बच्चों का पहले इंटरेस्ट देखना बहुत जरूरी है कि बच्चा कौन से स्पोर्ट में जाना चाहता है, लेकिन मैंने बहुत सारे केसेस में ऐसे देखा है कि अगर फादर क्रिकेटर है ना तो वो चाहेगा मेरा बेटा तो क्रिकेटर ही बने, या अगर फादर एथलीट है तो उसको एथलीट ही बनाना चाहता है, नो मैटर व्हाट कि आपका बच्चा उस चीज में जाना चाहता है या नहीं। तो दैट फोर्सफुली काम करने वाला जो टाइम होता है ना सर, 3-4 साल तो उसी में निकल जाते हैं, एंड देन दे रियलाइज ये तो कुछ कर ही नहीं रहा उसके अंदर, बिकॉज ही डजंट वांट टू गो एंड प्ले दैट स्पोर्ट।
So that's a very important decision. Parents have to take these things in mind.
They have to see the interest of the child first.
With this, I remember Yuvraj Singh and his father himself, a very renowned person.
Yeah.
And he always wanted his child to become an actor, and he made it. Excellent, he made it. And initially, I don't know how interested Yuvraj was, but then later on he started loving his sport and did excellent, amazing. So I keep reading the story on the media and
but
news channels.
That's not the case with every parent, I mean.
Not with every parent, true. But the interest of the child should definitely be taken into consideration, because otherwise, after some time, there will be a burnout, and the performance will drop. And then going to national, international will become difficult.
Sir, इससे मुझे एक example और याद आता है. If we talk about Usain Bolt, I think he was also in a team of footballers, where the coach defined him कि नहीं आपको footballer नहीं, आपको तो running अच्छी करनी चाहिए, आप athlete बनो. And that's how he switched his game.
So here the talent identification, at the school level, at the sports and clubs comes into picture. Yeah. So while doing, sports or while doing football, his coach must have seen, he's very quick.
Yeah.
He runs very fast on the ball.
Yeah.
So he noticed that he can do very good in athletics, short distance athletics. So he picked him up and guided him. So that guidance, from the various coaches and talent identification team is very important.
That's very important.
Now BCCI and the Punjab Cricket Association, they have their talent identification teams. They go to grassroots levels, conduct talent identification camps.
Yeah.
Arshdeep Singh, जो अभी इंडिया खेल रहा है, he was picked up by me, our team, in one of the talent identification programs. Wow. His first fitness camp, जो beginners के लिए हम करते हैं at PCA, was done by me, and see where he is today. So they picked him up. He was good, and when I conducted his first fitness test, that time I told his father that he will play for India.
I think that's very important.
So that's very important.
जैसे टैलेंट बाकी चीजों के लिए होते हैं, इसके लिए भी होना ही चाहिए, तभी बच्चा रिकॉग्नाइज कर पाएगा. इससे एक और एग्जांपल याद आता है सर. If you remember, there is an athlete called Gurvinder. I just did his podcast recently. What his coach told me, that how we identified that he's a very good runner. हमने एक दिन इसके पीछे कुत्ते छोड़ दिए because I personally felt that he can run well, but he was not giving his full potential. Somehow whenever I asked him to run, he just ran normally, casually. तो हमने मतलब प्लान करके उसके पीछे कुत्ता दौड़ा दिया, and then we realized that he has an excellent. मैं कहा that's a wonderful idea sir, लेकिन यहाँ इंडिया में ये चलना नहीं है.
Yeah, you need to find some way to find out the potential. Yeah, some way to find out the potential.
Sir, any nutritional advice that you want to give to our viewers for all age groups?
Okay, in general. Now, first thing is to avoid all kinds of junk foods, colas, ketchup, burgers, pizzas. Half of the food chains are using, adulterated cheese or duplicate nakli cheese.
Nothing is pure.
There's nothing. So, best is to have home-cooked nutritional food, a lot of fruits, a lot of vegetables, some nuts, milk products, curd. So be on such kind of a healthy diet. Sprouts will also help you.
Yeah.
So if you have a balance of these things, your diet should be rich in protein. Indian diets are always deficient in protein. Yeah. So you must add eggs, chicken, lot of chana, rajma, dal, sprouts. You can add at home, no problems. Some nuts. Those who are vegetarian, increase their intake of paneer.
Yeah.
So these things will help, and protein intake should be kept.
Sir, I think this has to be initiated from the very beginning of the childhood.
Very beginning.
अगर आप मिड में जाके सोचो कि अब चेंज कर दें बच्चे को, तो वो अडैप्ट कर चुका होता है. He wants that food only.
Yeah, the dietary habits should be developed right in the beginning. And the parents in the school also has got a very important role in this.
Yes, exactly. Was I about to come to that? If the parents are not encouraging that kind of food, if it's not available in the refrigerator, I don't think the child will long for it.
True. It should
definitely वो अपने उसमें आ ही जाएगा. जैसे कहते हैं ना, बच्चा जब रोता है तो माँ दूध देती है. अगर आप बच्चे को हैबिट ऐसे बना दोगे, यही है खाना है तो खाओ, अगर नहीं है तो भूखे रहो, तो he will definitely adapt to that habit, right?
Absolutely.
And one more question comes to my mind, sir. Like, you have been so busy, you've been working with so many corporates and hospitals. How do you manage your schedule?
It's time management. I work with one of the organizations from let's say morning 10 to 2. There was a time I was doing 3 jobs. I was working with BCCI, So I used to do morning 6 to 10, we were busy there, and 10 to 2 hours with another organization. Then afternoon 3 o'clock to 6 again I used to be with the Punjab Cricket Association, and then evening 6 to 9 I used to do my private practice. That was a very busy time, but now I've cut down a little. I've stopped traveling with the teams. I'm looking after all the people of various sports and general musculoskeletal injuries in the local area. So I've stopped traveling now. So I'm doing maximum work in the local areas now.
Wonderful. And last but not the least, आपको पता था आप Sipwithstars में आने वाले हो हमारे साथ?
Ma'am, I had no idea. You see, outside the 3 people are waiting. I have to do a procedure at 4 o'clock. I have absolutely no idea, but I was pleasantly surprised that you invited me to this Sipwithstars.
It's complete pleasure for us, sir, that you gave us your time, and we are really, really thankful to you. और we want कि आपके पास और अच्छे पेशेंट्स आए, आप अच्छे से सिक्योर करके उनको भेजें और सर्जरी की जरूरत ना पड़े.
Definitely, ma'am. That's our endeavor, and we'll continue to work hard.
Yeah.
And we've got a lot of time. And I remember, treating even Yadvinder sir for a hamstring injury.
It's his project actually.
His project, no? Mainly,
Yeah.
Okay. So I remember, he's an international athlete himself. He worked with Milkha Singh ji a lot. And he came to me with one hamstring injury before he was going for an international competition.
Exactly.
He said, "Mera masters hai, international masters hai, mujhe jana hai." I said, "Sir, nahi jana hai abhi, because this hamstring injury will not allow you to perform maximum potential pe." So we then finally skipped that international meet, but he's doing fine now. He's fit now, and I'm sure he'll continue to go for other masters.
Definitely, he needs treatment, and you have already given it. Thank you so much. It was lovely having you on the show, sir.
Thank you so much.
So that was our guest, Dr. Satbir, जिन्होंने हमारे साथ बहुत सारी valuable information share की है, और मुझे लगता है कि आप सबको अपने जवाब मिले होंगे, क्योंकि जो भी बातें आज उन्होंने हमें बताई, I think they are valuable to each and every family. आप इस एपिसोड को अपने नियर एंड डियर वंस के साथ ज़रूर शेयर कीजिए, खास करके अगर आपकी ज़िंदगी में कोई स्पोर्ट्समैन है और वो compete कर रहे हैं, अपनी ज़िंदगी में कुछ बेटर करना चाहते हैं, तो ये एपिसोड उनके लिए बहुत खास है, क्योंकि बहुत मेहनत लगती है हमें और हमारी टीम को इन एपिसोड्स को रेडी करने में. आपका एक लाइक, कमेंट, शेयर हमें और ज़्यादा मोटिवेट करता है कि हम कुछ और बेटर आपके लिए ले आ सकें. और हाँ, कमेंट करके हमें ज़रूर बताइए कि आप और कौन से ऐसे गेस्ट हैं जिन्हें आप चाहते हैं कि हम अपने पॉडकास्ट में बुलाएं और उनसे इंटरेक्ट करके उनके सवालों को आपके सामने पेश करें. सो स्टे कनेक्टेड विद अस. दैट वाज योर होस्ट Keesha, signing off from Sipwithstars.